All right. So first of all, thank you very much to the admin team for giving me this opportunity to speak to you all, to a group of very well educated and successful professionals from different places. The common thread is that we were all in one way or the other connected with Makerere University. When I got the call on the 18th of January to see if I would conduct this webinar, I said yes, because I thought of it as a real privilege. And thank you so much. So on the 20th of January, I sent out a general question, which is, if I was giving a talk to a group at your level on cardiology, what would you like me to talk about, or what questions would they want to be answered? So it's a very general question, relatively ambiguous, and I sent it to about 40, actually 40 people. These were from my WhatsApp contact that people I had interacted with over the past month. So these were 40 separate individuals, 32 responded, 8 did not respond, starting with my wife. You may be surprised, but I'm not. Anyway, so let's look at the people who responded. There were males and females, some were physicians, but the majority were non-healthcare professionals. They spanned a different age group, millennials, Generation X, baby boomers, and there were some from the 3 provinces of Canada and some from international contexts, most of which connect with me for their medical problems. So I received a host of responses. I was actually totally overwhelmed by the responses I received. And this is just a sample of all the actual responses that I received. So, and these are not absolutely all of them. So I say to myself, what am I going to do? I better get the help of my daughter, Arifa, who works for MD Clone, which is a company that deals with big data management in healthcare, and have her put all these responses through the computer and see what the computer with artificial intelligence comes up with. So this is what the mega computer came up with. It said that you essentially have to talk to them about the full current textbook of cardiology. You have to teach them a 3-year subspecialty cardiology fellowship program in 1 to 1.5 hours. And without them having done the internal medicine residency and without them having gone to med school. So that's so much for high-tech computers. Anyway, so I said, I'm going to look at it differently. So I reviewed all the responses, and they spanned the last 50 years of knowledge that we have garnered and obtained in the field of cardiology. And it has been an exponential increase in the past decade. And it spanned various new advances and inventions that are coming up over the next few years that will come into clinical use and will have varying impacts. Some will have very little clinical impact, and some will have very extensive clinical impact. And so you could actually have a talk on any one of these major advances. So I chose to stick with evidence-based medicine and essentially try and talk to you about what I think is important for you, your children, and particularly your grandchildren.